All right. Bismillahirrahmanirrahim. With that, Assalamu alaikum, Karibu, and have a good day to all of you. I welcome you all in the webinar series on policy dialogue. I am Dr. Saleema Gulzar, Associate Professor, Head of Public Health Stream at AKUSONAM University, School of Nursing and Midwifery. I'll take the honor to introduce my two esteemed speaker of the day. First, I'm going to introduce Dr. Rafat Jan. Dr. Rafat Jan is the currently working as a professor and associate dean of Global Outreach and Policy Unit of AKUSONAM University School of Nursing and Midwifery. She has been serving as a midwife, educator, researcher, and visionary leader for more than 3 decades. Wow. So such a tremendous time period that she's serving to the national and international level. She has been active towards the advocacy and rights of women and neonates and children at the national, regional, and international levels. Her contributions towards introducing strong midwifery regulation for Pakistan has been instrumental, and we cannot forget that she had completed her PhD in the area of health informatics, and you will be hearing a lot during her talk and question and answer session. She did her PhD in nursing informatics, as I said, and she has also served as a various leadership roles, such as director of the first undergraduate midwifery program, president of Pakistan Midwifery Association, and a board member of International Confederation of Midwives. She has been the pioneer to establish an index journal of Asian midwives with the dedicated team of national and international experts. She is on review and advisory board of the high impact journals called midwifery. Her future plan is to institute a systematic midwifery-led care in public sector. So this is all about Dr. Rafat Jan. So please give her a round of applause. Thank you, Dr. Jan, for joining us as a speaker. With that, beside her, we have Ms. Salimah. Ms. Salimah Taufiq is currently working as a senior manager. She's a nurse informatics at AKUSONAM University Hospital for Meditech expense EHR implementation across Asia and Africa. First implementation was successfully completed at AKUS Nairobi, which is very much part of it, and you will be listening her, sharing her experiences during her presentation. And she had prior expertise working as an IT nurse for several in-house HIS application to build and implement with IT team. She enhances technology in nursing and work with several departments to advance patient safety. Among her numerous nursing endeavors, implementing electronic medication administration records is the most crucial and long-lasting impact. So give her a big round, Ms. Saleema Taufiq. So with that, I'm going to invite Ms. Saleema Taufiq to start with her presentation. So ball is in your court, Saleema. Good luck.
Thank you, Salimah. And Assalamu alaikum to all my nursing colleagues who join online and who join personally. So thank you for joining. And I'm very happy to see many of the people join here online. So today the purpose of this presentation is about nursing informatics. Okay. So before me starting with the nursing informatics, let me share the experience why I have focused on this, having this session with you all. Last year, I have attended one of the Smart Health Summit. And in that summit, many of the doctors, physiotherapists, pharmacists, radiology staff, and IT staff attended that summit from various hospitals of Karachi, that is Indus, Liaqa, Ziauddin, and many other, Tabba. And I observed there is no nurse over there. And it clicked me, why no nurse over there? Because when we work in the hospital setting, And when we having, like many of the hospital already having the electronic health record with them, like Indus is having, Shaukat Khanam is having, Taba is having some of that. So they have the electronic system, and nurses are the one who is the custodian of all those data, who work on that data, who enters the data, who have put many input on that data, like simple example of admission record, discharge record, LAMA record, and all that. All nurses are there, but none of the nurses is representative over there in Health Summit. So then I thought, why not a nurse informatics concept need to be communicated at the country level, at the city level, and to my other nursing colleagues, that how can they participate in all those things and involve themselves for multiple research on that data, involve themselves in the nursing informatics and all that. So let's start with the presentation. So I've started with this. Nurse played a significant role at every stage of system life cycle. As I already shared, many of the data nurses do. So these are a few of the next. Okay, these are the objective. Nursing informatics and role of technology in nursing. Importance of nursing informatics. Various role in nursing informatics. Nurse informatics at AKU Karachi. That is very important, what I am doing since so many years. Okay. And then scope of nurse informatics. Data driven by nursing profession, patient care delivery processes. Nurse informatics out of hospital setting, and specialized nursing informatics forum and training program. That is very important to let you know. Okay, next slide, please. So here I start with the definition of informatics. First, before go to the nursing informatics, first we understand what is informatics. So informatics is about the harassments of the power, that possibility of digital data to transform to digital technology to transform data and information into knowledge, and people use every day in their life. So technology and informatics is not only about the clinical, not only about the nursing, not only about the medical. It's in every field of life. It's in finance, it's in engineering, and it's many other fields. But we are going to talk mostly about here the informatics in healthcare. Next slide, please. So in clinical informatics, when we talk about informatics, we have bioinformatics, we have health informatics, public health informatics. And in health informatics, we further have subfield, which is medical, nursing, pharmacy, and dental informatics. Next slide, please. So when we talk about the nursing informatics, excuse me, please.
While Saleema is having little bit sore throat, let me continue. That informatics is the world which is not new in the nursing. And outside Pakistan, nurses are forefront serving the role of informatics. So the early definition was actually came from computer technology, which was to all fields of nursing, nursing services, nursing education, and nursing research. But current definition, what nursing informatics is, that the nursing informatics is science and practice. If you recall those who are attending from our last sessions, we have always says that nursing education and practice both together. So informatics science and practice integrate nursing, its information and knowledge and their management with information and communication technology to promote the health of people, family, community, and worldwide. Now, let me give you one example. आप में से वो लोग जो nurses बन चुके हैं, and they have Pakistan Nursing Council license. And we did everything when I was, everything should be online because we need information, we need data to develop policies out of that data. So उससे हमें उस data से पता चलता है how many nurses, education level क्या है, किस specialty area में practice कर रहे हैं, number of midwife, number of lady health visitors. All these were completely, or data की जो main gold standard है, put data once. For example, when patients come for admission, हम बार बार data लेते हैं. The world of informatics is not like this. The world of informatics is put data once and that's it. It is going on and on. आपका जो NIC कार्ड है, जब आप अपने बच्चों का या आप भी बच्चे थे बनाते होंगे तो एक नंबर मिलता है बे फॉर्म या बी फॉर्म का, वही नंबर आपका चलता है NIC कार्ड में. और आजकल बैंक कार्ड्स और NIC कार्ड पे एक चिप लगा हुआ है. So what is that chip? The chip has complete information about you. तो आज की दुनिया में हम बहुत दूर जा चुके हैं, यानी हम पेशेंट की फाइल में जो डाटा डाल रहे हैं, अब दुनिया इतनी आगे जा चुकी है कि वेस्टर्न कंट्रीज में जब पेशेंट डिस्चार्ज होते हैं तो उनको कभी USB या चिप या ये दे दी जाती है, तो पेशेंट की डिस्चार्ज समरी और कंप्लीट डाटा उस चिप में होता है. So informatics world has gone very far. Next slide, please. Previous slide पे nursing definition.
Previous example. Previous slide. The first slide. After this. No. The slide which were on.
Next slide picture. Next slide. ये first. मैं खुद कर लेती. Yes.
So when we talk about the definition, Dr. Rafat, thank you so much. Dr. Rafat explained it very well, but I want to add one more point when we talk about the definition. Earlier, when we talk about the nursing informatics, we only talk about application of computer in technology because it's a very early stage, okay? And at that time, only the data is maintaining the Excel, okay? But now we are talking about the integration of data. That is very important because with integration of data, it's automatically give you some information. Like suppose if you have the vital parameters of temperature, pulse, respiration, and all that, system generate an early warning sign for you that give you the alerts that integrate your information, integrate and give you the information that your patient is suffering from the early warning sign. And because of that, you can have a prompt action to assess your patient, to help your patient, to call physician and everything. So that is a difference which is making nowadays with informatics. It's not only the data, it's the integration with assist you for the decision and all that. Next slide, please.
It's same with your NIC cards, bank cards, and like this. Due to integration of data, you get alerts. For example, if you are using money in any shopping mall, and when SMS come that you have used that money, this is integration of data. Similarly, agar Pakistan Nursing Council ka card expire hone wala and you generate the alert system ke saath, that is integration of data.
Okay, so moving forward, beside the definition, I want to add that by integration of nursing knowledge to manage communication of data into information with the help of technology, and all these produce knowledge. And now with all this knowledge, we can build a technical solution for information of paper documentation to the electronic version, which lead nursing-led application that I gave the example of one of the example of early warning sign. Similarly, the fall data, it automatically calculate the score for us. Similarly, for electronic medication record, it automatically give us how many doses administered on time and how many or not. And on basis of all those things, we can promote many research in nursing. So all these data, which is nurses are entering in the system in various hospitals, which are in Pakistan right now, Indus, Shifa and all that. With that, they can have a multiple research. So that is the purpose with this nursing informatics, to promote the research and all that in nursing. Next slide, please. So with all these, now I want to introduce various roles of nursing informatics around the world. Nurses are used as a subject matter expert and they support technical team to build the various things. Nurses work as an IT nurse to with our technology team to give clinical knowledge to build the system. Nurses work as a clinical analyst for the data and all that which is in the system. And nurses work as a nurse informatics, specialized nursing role for the informatics, who build the system as per the nursing need by working with the technical team and who participate in the implementation and all that. Recently, I'm working in that role and I have successfully implemented electronic health record in Nairobi Hospital, Aga Khan Hospital in Nairobi. Secondly, thank you. Secondly, moving forward, we have one more role in the informatics. This is a chief nurse officer. That is a role which is internationally recognized, and many of the nurses in the hospital leading this project as a chief nursing officer. So these are the roles which is internationally in functioning. In Pakistan, these role was introduced initially. Next slide, please. Okay, in Pakistan, this role was introduced in 2003 first time by the director of nursing with her visionary thought, because internationally this role was from the late 80s or early 90s. But in early 20, we introduced this role in AKU, and then we have the IT nurse, then nurse analyst, then informatics nurse, and we have the subject matter expert, all those. The nurse informatics at AKU is responsible basically to bring innovation in the clinical documentation by use of technology. So what they do actually, they do the assessment, and on need-based assessment, these nurses provide the recommendation, what system we need, what we need for the nurses. Like we give the example of phlebitis data, because our nurse infection control team having difficulty to get the data of the phlebitis, COTI data and all that. So what we did, we developed a system for this, application-based system for that. And with that system, they are now getting the phlebitis data in seconds, in minutes. So that is the benefit of the system. So what nurse do over here, the informatics nurse at AKU, they build the system with the technical team. They plan out the resource, they look for the budget, then they plan for the implementation, conduct the training, and after implementation, they didn't finish with them. They monitor the system in phase of evaluation. So these are the role whose nurse informatics is playing, and that is also not finished. After evaluation, they go for the post-implementation optimization. Here I quote the example of barcoding, because in 2012, we implemented the electronic medication administration record system over there. And then moving forward, what we decided, we should have more safety include to them, and we attach the barcoding with them for patients' rights, the 5 rights, right dose, right medication, right patients and all that. So in 2016, after that, we added the barcoded feature with electronic medication administration. So this is the way nurse informatics move in different hospitals, and we in other hospitals we can do similar activities. Now, nursing informatics scope. Next slide, please. This is all about the scope of nursing informatics. Nursing informatics support technical requirement for nurses and assess for various issues like phlebitis. I already gave the example. Nurse informatics develop and evaluate the application. Like I gave the example that we develop the application, we evaluate and then increase one more feature in that. Nurse informatics work with the process team to build the processes, to structureize the processes and to streamline all those processes so it could be run smoothly. Nurse informatics collaborate with all other healthcare team and IT professionals and other departments to have the smooth system for nursing. So these are all the things which is nursing informatics scope. Nurse informatics support consumer, patient, interprofessional health team members and other stakeholders in their decision making in all the role setting and throughout the structure, process, and achievement of information technology. So these are various roles played by nurse informatics. So with this technology, we have many systems in the hospitals, and you have all those data. So you can introduce this role in various hospitals, and we can have all these things. We have the cross hospital research with together and all that. Then nurse informatics is important. Why it is important? I already talked about that. The nurse informatics role is to bridge the gap between delivery of care and and documentation and technology. Nurse informatics participate in building of technical solution that nurse can rely to provide optimal patient care. To supervise the data, supervising the data where the information is stored. Nurse informatics also help in analyzing the data. I've already communicated that in the role. And all the quality nursing practice transform of data into useful information. Nurse informatics taking part in the decision making as well. Like if I share the example, we'll move further and I'll share one of the example and you can understand it better how nurse informatics take role in decision making. Okay. Next slide, please. So here is, I just described the process that when there is a people, like suppose nurse is a people, technical team is a people, management is a people, all those people, when they sit together, they build the system, they use the software, and nurse informatics role is there. In the application building, they work with the software team. Then they work with the hardware team, the nurse informatics, to have all the hardwares available. Then nurse informatics work with the network team for the connectivity and all that, for Wi-Fi connectivity, landline connectivity. And then nurse informatics train her nurses to enter all those data in the application to get the information system and to get the knowledge out of that data to have multiple benefit of that system. Next slide, please. So here I would like to share the example, like I have quoted earlier that we have the electronic medication administration system. So in electronic medication administration, when we have it, we've identified some specific problem, and problem is that all the medication administration is delayed. Okay, so that is the problem we identify. After identify of the problem, we decided what to do, what would be the alternative. Then we go to the technical team, we decide, we sit with the management and we decide for some alternative. And that alternative, we set the clock in the system for block 1 hour plus minus. If nurse do the medication later than 1 hour, she need to give the reason. So we block that and we are getting the reason. And once we did that, after a few time when we did the study, we identify, okay, now we are able to capture how many doses are delayed and why they are delayed. Some of the reasons are pharmacy dispenses the medication very late. So we need to work on that. So that's the way informatics help us and we improve our decision and improve our clinical practice. Another reason, we identify that system is not working very fine. It's working slow, system frequency issue. Then what need to do? Then we need to work with the network team to improve the connectivity. So in this way, nurse informatics can work. Next slide, please.
Go back. These are the core of nursing informatics or any other: data, information, and knowledge. So what nurses are doing and others are doing, they are doing input in the computer, either the bedside handheld, they put the data. Then the data is converted into information. And then we have to make sense. And this information, then when what Saleema was just saying, whole team sits together and then change into the knowledge. So when you heard in my profile that in my PhD program, when these three things, the whole PhD program, when all the students were doing informatics and I was doing, then I discuss with my team that there is one piece is missing. And I said, that is nursing soul. And so then I wrote into my dissertation that the data is changing into information, information into knowledge. However, we have to take this knowledge into action. And if we are not doing nursing action, then the nursing soul is missing. So when I wrote in my dissertation, what Saleema was saying, American Nursing Informatics Society, who works under the ANA, she sent that piece to them that one of the PhD student is requesting for that to be included. So now if you see current guidance, the data, information, knowledge, and then the thing comes action. So we have to translate that nursing knowledge into action, what Saleema was saying. So whole piece of nursing informatics core pillars will be data, information, knowledge, and action.
Next slide, please. So as Dr. Rafat mentioned, data, information, and knowledge. And with data-driven, and with all these, nurses can have a data-driven decision for nursing professions. Like I'll give them many examples. So nurse can advise, help their nurses or their institution for providing consultancy, for developing a program, for developing various applications, various research and all that. Nurse can also participate in designing the user-friendly system for nurses. Like when we are working on electronic health record, when we are observing what is available in standard software, because we purchase the Meditech software, and we observe that many of the things in that, which is not according to our culture, which is not suitable for our requirement. So we make that modification and we make it user-friendly. Similarly, after all these things, the nurse informatics help in test the software and then check the suitability of that software with the setting, with the institution, as I gave the example. And also this nurse professional involved in the planning, design, development, implementation, and evaluation of the system, which I already communicated earlier with the EMAR. So these are all nurse help their institution by having all these knowledge. Next slide, please. Okay, nursing informatics, it's not only in institution within the hospital, it is outside the hospital. Before we discuss something about the outside hospital, Dr. Rafat would like to add something. Dr. Rafat,
can you put the another slides? It's the time that we will take you to something else. My slides. Can you put what happened if you look at the doctor's handwritten manually or in the electronic databases, which is electronic health record, doctors are using very typical language. And that language is standardized. For example, if the patient is diagnosed with cancer, whatever specification of cancer, you will see all doctors are writing same cancer. So for example, breast cancer, whatever lymphoma, they all write same word. They will not write different word. And that is called terminology. So what is going to happen, that because all the doctors are using standardized and same terminology from a International Classification of Disease, ICD, and the current number is what, 2010, ICD-10, which is public data, which is published from WHO. So all the doctors are using that classification. That means when they need this data to see how many admissions are happen under the same diagnosis, then they match with other hospital by sharing the coding, not the data of the patient, but each terminology or each name. For example, simply jaundice, it is written 100.1 and 13. So they will share the coding, and this coding will go across the Pakistan, and they find out what is happening, why so many jaundice is happening in that kind of season. So that's terminology. So they can just see, they start doing media programs on the media or admissions, what they have to do. And if they want to do research, it's the standardized terminology. So nursing terminology and classification system have been developed. But what Saleema has presented, we are not using at Aga Khan University. And we are striving since last 20 years, and we have developed few things. So like ICD for medical terminology, which is built in electronic health record, nurses can leverage, but that knowledge is not built in right now in our system, not even medtech, I ask. Next question, next slide. So what is the meaning of terminology? Whether it nursing specific terminology or interdisciplinary terminology, they all exist. And how they match, actually they match this through integration, but that integration come with the coding. And so they built, हमारे पास जैसे इंग्लिश की थिसॉरस और डिक्शनरी होती है, इसी तरह इन टर्मिनोलॉजी की मेटा डिक्शनरी या मेटा थिसॉरस होता है, जिसको हम यूनिफाइड मेडिकल लैंग्वेज सिस्टम UMLS कहते हैं. और उस सिस्टम के थ्रू हर कोई कहीं भी कोडिंग ट्रांसलेशन कर सकता है. अमेरिका में नेशनल लाइब्रेरी ऑफ मेडिसिन है, मोस्टली लैंग्वेजेस वहां पे रजिस्टर होती हैं, वहां से आती हैं. तो स्नोमेट CT, दैट इज अ वेरी वेरी अनदर इंपॉर्टेंट लैंग्वेज जो मेडिकल टीम यूज करती है. फिर लॉइंक, लॉजिकल ऑब्जर्वेशन आइडेंटिफायर नेम्स एंड कोड्स, ये ज्यादातर लॉइंक जो है वो लेबोरेटरी यूज करती हैं. तो पाकिस्तान की जैसे AKU की लेबोरेटरी वो, तो फिर इनको जब एक्रेडिटेशन मिलता है जब ERC में, तो वो लॉइंक कंपनी जो रन करती है वो देती है. तो स्नोमेड और लॉइंक बेसिकली सारी लैब्स यूज करती हैं दुनिया भर में. और AKU, आई एम श्योर शौकत खाना में भी लॉइंक ही यूज कर रहा है, बट आई डोंट नो, बट AKU इज यूजिंग लॉइंक फॉर लैब्स. अब क्या है नर्सिंग का, क्या है नर्सिंग की जो है बहुत सारी लैंग्वेजेस हैं. इतनी सारी, जैसे सबसे पहले ओमाहा सिस्टम आया, फिर पेरी ऑपरेटिव सिस्टम आया. बट देन नर्सेस सेट एंड थॉट कि हर नर्सिंग लैंग्वेज जो है, स्पेशली आप में से जो लोग AKU में पढ़े हैं या जो और नर्सिंग स्कूल में पढ़ते हैं, तो करिकुलम में जो है नांदा, ठीक है, नांदा जो है वो डायग्नोस्टिक लैंग्वेज है नर्सिंग की. ये आ चुकी थी 20-25 साल पहले. When Nanda came, Suddenly nurses started realizing कि what is happening. America से ही 9 languages आ गई, जबकि doctors में एक ही language है, ICD. एक ही language है, SNOMED, CT, that they are using for different clinical purpose. या एक ही है allowing what they are using for lab. मगर nurses में तकरीबन 9 languages थी. तो जहाँ पे यूनिवर्सिटी ऑफ आयोवा में आई डिड PhD, वहाँ पे बड़ा इंफॉर्मेटिक्स का था. तो वहाँ की टीम जब नांदा की कॉन्फ्रेंस दे अटेंडेड, दे सेड नांदा इज जस्ट द डायग्नोस्टिक लैंग्वेज, उसमें नर्सिंग इंटरवेंशन तो कैप्चर ही नहीं हो रहे, नर्सिंग आउटकम तो कैप्चर्स ही नहीं हो रहे. तो यूनिवर्सिटी ऑफ आयोवा, आई वाज सिटिंग राइट देयर, वहाँ पे निक और नॉक को मैंने बनते देखा, और फिर NNN का कॉन्सेप्ट आ गया, नांदा निक नॉक, क्योंकि फिर नांदा ने इनको ज्वाइन कर लिया. और यूनिवर्सिटी ऑफ आयोवा में एवरी ईयर 3NNN की कॉन्फ्रेंस टेक प्लेस करती थी, जहां पे वो कोडिंग्स, न्यू टर्मिनोलॉजी आते थे. बट व्हाट हैपेंड, Nanda, Nick, Knock, they sold their rights to the company. So then nobody can take it. तो वहीं पे WHO और इंटरनेशनल काउंसिल ऑफ नर्सेज में जब ये बात आई कि नर्सेज आर गोइंग टू लिव बिहाइंड, तो वहां पे ग्रुप्स ने बैठ के काम किया और इंटरनेशनल क्लासिफिकेशन ऑफ नर्सिंग प्रैक्टिस ICNP. अगर आप लोगों को इंटरेस्ट है तो आप इंटरनेशनल काउंसिल ऑफ नर्सेज की वेबसाइट पे जाइएगा एंड प्लीज चूज ICNP, इंटरनेशनल क्लासिफिकेशन ऑफ नर्सिंग प्रैक्टिस. वहां से आपको कोडिंग, टर्मिनोलॉजी सब कुछ मिलेगी. When I was student, मैं एक दफा जिनेवा गई थी with my preceptor. They asked me why nurses are not using. And when I looked through it, nobody understand the coding and terminology. So I sat with some of nurses and we developed few example for them, जिसको हम केयर प्लान बोलते हैं, कार्डियोलॉजी और मैटरनिटी सेटिंग के लिए. तकरीबन हमने 7 डेवलप किए. और जब आई वेंट बैक इन विस्कॉन्सिन, दे लुक्ड एट इट एंड दे अंडरस्टूड. मगर बैकग्राउंड में अब ये इसी तरह से एग्जाम्पल दे रहे हैं. मगर इंटरेस्टिंग थिंग इज दिस कि सामने से आपको जो नर्सिंग केयर प्रोसेस नजर आता है, नर्सिंग उसमें सारा है. they are not using the word nursing diagnosis, क्योंकि मेडिकल वाले भी वर्ड, they are using nursing phenomena, they are using nursing action, क्योंकि इंटरवेंशन जो है वो बहुत छोटा होता है, नर्सिंग एक्शन डिक्शनरी के मुताबिक बड़ा होता है, नर्सिंग आउटकम. ये 3 अंडर दीज 3 सब क्लासिफिकेशन ये लैंग्वेज है, और इस लैंग्वेज की कोडिंग है. और इस कोडिंग को इन सारे 9 लैंग्वेजेस ने ही सिर्फ एक्सेप्ट नहीं किया है, WHO ने एक्सेप्ट कर लिया है और ये पब्लिक डोमेन पे है. अब why I am saying we have to use this language, and I am saying because if we are not going to use this language, तो हम अपने इंटरवेंशन किस में कैप्चर करेंगे? सलीमा एक लैंग्वेज में लिखेगी एक हॉस्पिटल में, रफत जान दूसरी हॉस्पिटल में कुछ और लिखेगी, और तीसरा कोई और कुछ और लिख रहा है. अब जब हम इंटरवेंशन चेक करने जाएंगे, फॉर एग्जाम्पल इट्स अ ब्यूटिफुल व्हेन यू डू द कोडिंग. हमने बहुत सारी एजुकेशन मॉड्यूल्स बनाए, रिसर्चेस की यूनिवर्सिटी ऑफ आयोवा में, जस्ट थ्रू द कोडिंग वी वर मैचिंग विद द कोडिंग. तो हमें पता चल गया, फॉर एग्जाम्पल वन ऑफ माय कलीग जब इसने अपना डिसर्टेशन प्रेजेंट किया, तो कोडिंग के हिसाब से patient education were the highest intervention at discharge. The question was asked, why you see in last 6 months this intervention and this outcome at the peak? She couldn't reply because she was not from America. And then committee respond, because America में policy accept हुई थी कि any patient who is going to discharge cannot discharge without the signing and without having discharge teaching. Discharge nursing teaching, by the way. उस policy की वजह से that intervention with the coding was higher, and when she evaluated data, This was the beauty of this. So we all have to start thinking कि जब हम electronic health record, and I did one of my duty as an advocate and policy person, जब हमारे AKU में medtech जो सलीमा ने introduce, I did ask for ICNP language, और उन्होंने कुछ टर्म्स तो डाले मगर अभी तक भी नर्सेस को बहुत मेहनत करनी पड़ेगी. दिस इज जस्ट द इंट्रोडक्शन. इसकी बहुत डिटेल्स हैं, बट दिस इज जस्ट द इंट्रोडक्शन इन सिंपल लैंग्वेज. तो सॉरी, मैंने आपको पहले ही बता दिया था, ये है ICNP, जिसमें वो वर्ड क्लाइंट लिखते हैं, पेशेंट नहीं लिखते, क्योंकि कम्युनिटी भी होती है, नॉर्मल लोग भी होते हैं. और उसका फोकस क्या है, जजमेंट इज द आउटकम. मैं इस डिटेल में नहीं जाना चाहती हूँ, बट आई जस्ट पुट इट द फिगर. थैंक यू. ब्रिंग सलीमा's स्लाइड. सो हम हमारी पॉलिसी के और हमारे ये पॉलिसी डायलॉग है, इसमें हम आपको सिर्फ एक इंट्रोडक्शन दे रहे हैं, बट इंशाल्लाह वी विल सी how much demand तो हम future में इसको करेंगे. So I'll give microphone again to Saleema for telehealth.
Thank you, Dr. Rafat, for all these detail about the nursing coding and all that, the nursing language and all that. So moving forward with the nursing informatics, which we are introducing today, the nursing informatics role. So nursing informatics is not only in the hospital setting. Nursing informatics is also out of hospital as well. Nurse can work for the telehealth project, like for remote clinics and all that. For robotic machine is an example of telehealth, when medication dispensed automatically. Then with the telescope consultant, in telehealth, they can use a telescope, scopes, and telescope consultation can be done. And with the webcam, like a few days back, I saw somewhere where we have a webcam setting in entire ICU, and people can remotely access the entire ICU from that webcam. And I remember that during the COVID time, AKU also observing the ICUs and other hospital of the northern area. And beside that, nursing informatics also work in e-learning concept as well. So this is not in the hospital, out of hospital as well, but nursing informatics is the concept which we need to introduce in our part of the world. Internationally, there are many nursing informatics forum. Next slide, please. Like they have the Canadian Nursing Forum, they have American Nursing Forum, they have European Federation, Australian Nursing Forum, and all that. But over here, we need to take initiative, and this is the main purpose of this policy dialogue, that we need to have initiated the Nursing Informatic Forum in Pakistan as well.
जब तक सलीमा नेक्स्ट स्लाइड पे जाती है, मैंने नर्सेज लैंग्वेजेस की आपको बताया. इसी तरह नर्सिंग मिनिमम डाटा सेट आया. नर्सिंग मिनिमम डाटा सेट वाज वेरी इंपॉर्टेंट, जो नर्सिंग लैंग्वेजेस से आया. अ वेरी फेमस नर्स जिसने सबसे पहले नर्सिंग लैंग्वेजेस पे बात करना स्टार्ट की थी, उसके बहुत फेमस वर्ड्स हैं. उसने कहा, इफ वी कैन नॉट नेम इट, we cannot measure it, we cannot evaluate it, we cannot see it, nursing cannot be visible. तो मैं आपको एक छोटी सी एग्जांपल देती हूँ. जब मैं ये सारा काम कर रही थी, तो I went to Hyderabad in one of the public sector hospital or nurses के पास, and I put 3 charts and I wrote what do doctors do, what do others do, like pharmacists, paramedics, and what do nurses do. जो फर्स्ट चार्ट था, जितने भी ग्रुप्स में थे वो पूरा, और हमने इनको पेशेंट चार्ट्स दिए हाथ से लिखे हुए मैन्युअली. उन्होंने उस चार्ट से इतना कुछ जो डॉक्टर ने निकाला था, पूरे चार्ट्स भर गए थे. व्हाट डू अदर्स डू, वहां पे हाफ चार्ट भरा हुआ. एंड व्हाट डू नर्सेस डू, यू विल बी रियली एस्टोनिश कि क्या लिखा हुआ था. उसमें लिखा हुआ था, फॉलो द डॉक्टर्स ऑर्डर, एंड दैट्स इट. जब हमने वहां पे नर्सेस को कहा, बट what orders you follow, जब उन्होंने एक्सप्लेन करना शुरू किया तो we said, where is here? You are saying you are giving medication, you are taking vital signs, patient की position change. Where is this? अगर मैं इसको कोर्ट में भी ये डॉक्यूमेंट ले जाऊं, you're not existing. So I remember those words. If you cannot name it, you cannot measure it, you cannot evaluate it, you cannot see it, you are not visible. तो ये डॉक्यूमेंटेशन हमारे लिए जो यहीं से डॉक्यूमेंटेशन बहुत स्ट्रांगली इनहेंस हुई है, इलेक्ट्रॉनिक हेल्थ रिकॉर्ड्स और नर्सिंग मिनिमम डेटा सेट और नर्सिंग लैंग्वेजेस से, दैट इज सो मार्वलस. तो हमारा आज के लिए यही था. नेक्स्ट स्लाइड. हमने आपको आज बहुत सारे एग्जाम्पल के साथ किया है और माशाल्लाह 62 लोगों ने इसको अटेंड किया है और हम इसकी स्लाइड्स भी और ये पूरा हम रिकॉर्डेड रखते हैं अपनी वेबसाइट पे. हम ये चाहते हैं, मैंने अभी देखा क्वेश्चंस इतने नहीं हैं, बट हम पूरे 1 आवर का सेशन रखते हैं, सो मोस्ट ऑफ द पीपल कैन अटेंड. क्योंकि आप में से काफी सारे लोग अपना मोबाइल डाटा यूज करते हैं, तो हम एक हद तक मोबाइल डाटा आपका यूज करवाएंगे, इसीलिए हम टाइम पे स्टार्ट करके टाइम पे ऑफ करते हैं. सलीमा और मेरा इरादा ये है कि हमें नर्सिंग इंफॉर्मेटिक्स का हम एक कोर्स डिलीवर करना चाहते हैं. तो अगर आप समझते हैं कि आज और उससे ज्यादातर पॉलिसीज जो बनेंगी फ्यूचर में वो इलेक्ट्रॉनिक से ही आएंगी. अगर वो डाटा नहीं होगा तो बिलीव इट और नॉट, हमारे कंट्री में हमारे पेपर डॉक्यूमेंट्स को चूहे ही खा जाएंगे, कुछ नहीं बचेगा. तो इलेक्ट्रॉनिक डेटाबेस होगा चाहे किसी भी फॉर्म में. तो इफ यू नर्सेस थिंग्स एंड इफ यू आर इंटरेस्टेड, पाकिस्तान गवर्नमेंट भी पास में तो जाने वाली थी, इंशाल्लाह जाएगी. पिम्स ने थोड़ा बहुत स्टार्ट किया था, फिर रुकते हैं, फिर ये, तो इंशाल्लाह एक दिन पाकिस्तान में इलेक्ट्रॉनिक हेल्थ रिकॉर्ड होगा. आज हमारी बैंकिंग सिस्टम को देख लें, सारा हमारे फोन में है. तो जब मैं प्रेसिडेंट पाकिस्तान, तो मेरी ख्वाहिश थी कि हमारा पीएनसी का लाइसेंस भी हमारे फोन पे हो, हम फोन पे ही एक्सेस कर सके, और हमने मोबाइल तक पहुंच भी गए थे. तो इंशाल्लाह वो दिन जरूर आएगा. विजन देने वाले एक ख्वाब देके जाते हैं, एक ड्रीम देके जाते हैं, फिर आने वाले लोग इस ख्वाबों को ट्रांसलेट करते हैं. वी वुड लाइक टू से थैंक यू सो मच एंड वी विल लुक फॉरवर्ड कि आप हमें अपने कमेंट्स, इफ यू आर इंटरेस्टेड इन सम काइंड ऑफ दिस कोर्स, तो प्लीज अपने आप कमेंट्स जरूर भेजिएगा हमें. एंड वी विल श्योरली लुक एट, हाँ हमें नजर आ रहा है, तो वो सारे लोग आप लोग लिख रहे हैं, तो इंशाल्लाह we will get back to you again. Thank you so much and Khuda Hafiz. Sorry, मैं सलीमा को दे रही हूँ जो हमारी moderator.
All right. So I think amazing, insightful presentation by both of our speaker, Dr. Rafat Jan and Ms. Saleema. I really
Saleema,
would like to thank
I
you.
like to introduce, जरा कैमरा आप उस तरफ करें, सॉरी मैं. हमारी फॉर्मल डीन डॉक्टर रोजीना भी आज हमारे साथ इस रूम में आई हैं, और हमारे एक सीनियर फैकल्टी मिस शहनाज कासम भी हैं, और आप में से बहुत सारे लोगों के ये टीचर्स भी होंगे, और हमारे साथ मिस यास्मीन पारपियो भी हैं. तो आप देखें ये सेशन कितना इम्पोर्टेंट है, कितने बड़े बड़े लोग रूम में बैठ के फेस टू फेस और हमें सामने से इतने थम्स और दे रहे थे कि शायद अभी मैं उठूंगी तो मेरा हीमोग्लोबिन बढ़ चुका होगा.
Yeah, so I think the lot that we are thinking and reflecting after listening to that presentation, and since Dr. Rosina, you are here and you've been involved and engaged in the research, so do you wanted to say anything pertaining to nursing informatics and the research? So over to you.
No, I think Dr. Rafat Jan and Saleema have explained so well. I, in fact, wanted to only ask that that when are we going to use language in the codes while we are starting EHR at AKU. So I'm now focusing, bringing the knowledge of the world to AKU, that when in the presence of Dr. Rafat, Saleema, and Saleema Gulzar, you have worked in the community in webcam and telehealth with EHRC and with the country going into EHRC. Also for Tech for Life, you have worked a lot with them in the school system. So when are we going to bring the language in the codes that when the EHR starts, we are able to look at the data and do the research like Dr. Rafat was mentioning ICD-10. So I'm looking at that time when East Africa have started and we can also start in Pakistan. And in that sense, we can have AKU global data to materialize that vision. So I'm looking at nursing action. What Dr. Rafat said, nursing action ki baat kare. So nursing action pe jaane ke liye, we really need to do the actions fast. So I will just say that use the Nike slogan, just do it.
We are going to monitor the chat, and fortunately or unfortunately, discussions and the presentation was so insightful and interesting that we could not address all the questions, but I'm sure that many of the questions are being addressed while the presenter were explaining. And thank you, Dr. Rosina, for your very insightful comment about the research and relating it with the nursing informatics. And I really would like to thank you all for being so attentive and staying till the end. And stay tuned. We are going to update you, inshallah, with upcoming webinar series. So have a good day and have a wonderful day ahead. Allah Hafiz.